Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today, co-founders Morgan Hare and Dr. Rohrich discuss their motivation to create MD Source and why it's so important that the patient be as informed as possible and take a more active role in their own medical care.
Well, welcome to MD Source. This is our first podcast on this incredibly new and innovative way to help educate you about medical care. I'm Rod Rohrich. I'm a board-certified plastic surgeon. I'm a physician first and a plastic surgeon second. I have been practicing in Dallas for almost 30 years. I'm a recognized expert in my field. And more importantly, I care about my patients. I care about medicine, and I care about the future of this country, especially in healthcare. And even with the incredible advances that we have in healthcare today in a wonderful country like the United States, we have a lot of potential challenges. And MD Source will be providing you with a very safe and efficient way to navigate your way to best health and best care so you become an informed you going forward in your life. And that's really what we want to do to help you. My partner in this is Morgan Hare, and she's going to talk about her background and why she's an integral part of MD Source.
So I started out doing research at Harvard Medical School and then moved into marketing medical equipment, and have really been interested in healthcare and providing good information to people, because there have been times in my life when an issue has come up and I didn't know where to turn to. I didn't know how to find the person to help me treat what was wrong with me. I had Bell's palsy several years ago, and luckily, because I know Dr. Rohrich, I was able to call him, and he got me to somebody, and I have no residual. And that's the kind of care you want. You want to be able to get to the right person to help you overcome whatever it is that's happening to you at that moment so that you really do get the best care. So I believe that what we're doing really fills a real niche that no one's talking about. It's sort of, we're all underserved in a way in terms of really getting the right information. And even when you go out on the internet, how do you put it all together to find out what's really right for you and where to go?
Now, medical care today is very, very complicated because it's confusing. Even though we have perhaps one of the most technologically advanced medical care systems in the United States, good luck trying to get the care you want when you need it and where you need it. And most of the time it's when you need it, like you have an emergency. Your family member's been in a bad accident, your sister has breast cancer, and you don't know where to turn, who to go to, who's best, and what should you do? What is the right direction? How do you find an expert? That's what MD Source will do. It will provide you with the resources to give you best care, safe care, wherever you live. And you may wonder why that isn't even available today. And so myself and my partner, Morgan Hare, have actually thought about this a long time, and that's why we are doing MD Source, because we feel there is such an incredible need to do this, because all you have to do is go on Google and type in whatever problem you have. Let's just say you have hypertension. You type in hypertension and you'll perhaps have several 100,000 responses, and you don't know how to sort out what's valid, what's not. And just because it's on the internet doesn't mean that it's true. So how do you get best care rapidly in face care? So did you know that the most common and the most famous doctor of all is Dr. Google? And Dr. Google is not even a doctor. He's available 24/7. And he's wrong about 70% of the time. So why do we keep going back to him? It's kind of like the weatherman. You know, We keep going back to other men. Many times they're wrong too. It's because they're there, they're available. So we are going to give you a more validated Dr. Google source.
This is really an important issue for people today. We're all confused about where to find the best care, who to call, what do I believe in what I see on the internet. Am I confused? Have I found the right information? Have I found the right doctor? What are the top hot topics that people are most concerned about today?
You'd be amazed. It's a variety of incredible topics from, do I have heart disease? Do I have hypertension? What's Alzheimer's look like? How do I find someone if I have breast cancer or prostate cancer? And what if I have a stroke? Where do I go? Who do I need to have there with me to get best care? What if I have diabetes or attention deficit disorder? Or if I'm having suicide or depression types tendencies? These all need more urgent type of answers. And you can't just keep searching on page 1 through 50 in Google. You need a reliable source that you can go to and say, aha, I'm going to go to this hospital, this doctor in this part of the country, and I'm going to get best care. We're going to give you that access to get best care, find a true expert in all aspects of medicine, from what we've just talked about, from oncology and breast cancer to diabetes to your hypertension specialist. Because today, there are no more primary care doctors. When patients come to see me as a physician, they don't have primary care doctors anymore. They say, well, it just depends on who's on my plan. And that's problematic because your plan changes all the time, and you don't even know who your primary care doctor is if you even have one in your plan.
I think the other thing we also want to cover are hot topics. There's so much in the news today that causes confusion. If you have breast cancer, should you continue taking hormone therapy? Should you not? Do I really need chemotherapy? Do I not?
Yeah, or do I even need surgery? I mean, there are recent studies that show that you may need less surgery and not even as much chemo at all. So where do you get best answers, best care? And we can drive that home for you no matter where you live.
It's really sorting out the information and getting to the heart of what you need to know about what is concerning you at this point, or just reading about an interesting article. I read one today on how they can stop a gene from developing a disease. And that's just the start of what's new in cancer treatment or unique diseases. So we're going to help sort that out for you. We're going to provide the information and also provide information if you are suffering from a disease, where are the places that you can go that you can be part of a study. No one should be left without the ability to get the care they need and have options for their care. It's really important today.
Absolutely. And the other thing is, there's so many myths in medicine. Do fish oils work? And do multivitamins work? Recent studies have shown that actually long-term studies on the use of fish oil do not help you prevent having coronary artery disease or even heart attacks. And the same thing with multivitamins. But we'll get the experts to actually talk to us about what to use, where to use it, if you need it at all. Other things like hypertension, there's a lot of controversy now on what is a normal blood pressure. I mean, I'm confused because it depends on your age. It depends where you live. Should it be very low? And do you need a cholesterol fighting pill to take if your cholesterol is above, 100 or 120? That varies significantly. We'll find and have the experts that are going to tell us what makes the most sense with the best science today. So what we're going to do going forward is we're going to talk about specific topics. And not only will there be these most frequently asked questions on Google, but there'll be also the hot topics that Morgan mentioned, but even some that are seasonal. What happens when you have a tick bite? Do you have a high chance of getting Lyme disease? And what do you need to do for the flu season? I mean, do you need to get the flu shot? I mean, some years yes, some years maybe. And And what do you do when you travel? Do you need to get all these vaccinations? We'll have our infectious disease expert tell you what you need to do and what you need to not do, and perhaps also tell you what areas of the world you probably shouldn't go to right now. So these are all common sense questions to keep you safe. Also, if you do get sick and you're abroad, what are the best ways to get the best care? Many times, it's how to get air evacuated back to the United States. And what are the best ways to do that? Do you need insurance if you're traveling in Africa for a prolonged period of time, especially if you have any health problems? The answer to that is probably going to be yes. But we'll provide you with a travel expert, a medical travel expert that's going to show you how to do that and how to do it well, safely, and cost effectively. These are all things that I deal with every day with my patients. I had a patient of mine that I had done some surgery on several years ago, and her husband developed a stroke. And of course, they were in a rural area, but we got him to a regional hospital that actually had a very up-to-date aggressive neurology team that actually treated him. So he had an evolving stroke, and they saved his life. And those are the things in times when minutes, not hours or days count. That's what MD Source is going to do for you. MD Source will provide you with your immediate, up-to-date time capsule to keep you healthy, keep you safe, and give you the best medical information and hopefully legitimatize Dr. Google. And that's what we're going to pledge to do with each and every one of these podcasts.
At the end of the day, we want to help you to be the most informed you so that you can get the best care, the best doctors, and know what you should do next if you run into a situation where you need medical care.
That's right. And so we're going to also ask you for questions on all of these different areas. When we have a hypertension expert, a blood pressure expert, we'll take your questions and see what you would like to know. Does exercise help? Is it just all genetically based? Which antihypertensive meds should you consider not taking, or which ones make you very tired, or ones that perhaps may not be good for you? Because medications, by and large, are all certain types of poisons, and they will help you more than hurt you, but you need to balance that with what and how you feel. So those are the types of things that we're going to give you some good advice on. So we're gonna streamline your care, and more importantly, we'll get it so that when you go on and you have an emergency at night and you're going on Google, you'll hit MD Source and you know you'll be safe, you'll be home, and we'll give you best care. I grew up on a ranch in North Dakota, didn't speak English till I was 6, and there were no doctors for over 100 miles. So you may wonder, why the hell did I become a doctor? And it's because I wanted to be able to provide health care so that you didn't have to drive 2, 3, 4 hours, and also be able to get care so that you could get good care. And so my background is a little different, but the goal is the same. We want people to be very informed and educated about their own body, their own health, because today, in this complex world of healthcare, the best person that's advocating for you will be you. You have to be educated about where to go, what to ask, and how to find out if you truly are getting best care. So that's the goal of MD Source. If we save one life, one person from having a stroke or a heart attack, that's a success every day. And that's what we're planning to do. And we want to be able to give you what we as physicians take for granted, that we have the knowledge, we have the connections to get good care for our friends, our patients, and our families, But we want to be able to translate that so that you can have it as well. Because I spend many hours every week as a physician helping my patients get exactly the type of care that MD Source is going to be able to provide for each and every one of you. So that's our lofty goal. And we want your help and your questions along the way to make us better, certainly to steer us in the right direction when we stray, but also to make sure that we stay focused on this very, very simple mission. Best care, informed care, so that you will be a better informed you when it comes to your own health.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.